Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. I'm Brittany Schaefer. Today we're talking about the recovery of joint replacement surgery. What typically happens after hip replacement surgery? Do patients stay in a hospital for a few days?
Most patients go home after surgery, and that's where we prefer people to recover because it's the safest place for patients. Some people actually can go home the same day of surgery if they're healthy and they feel fine after surgery. Most patients will stay one night in the hospital and go home the next day.
Can you explain the standard rehab process?
Rehab from total hip replacement is pretty straightforward in that you basically just have to get up and walk around. Some surgeons will limit how much weight you can put on your leg afterwards while the bone is healing to the implants, but others will let you put full weight on it right away. For knee replacements, the rehab is a lot more extensive and involves working hard to get your leg fully straight and bend it back as far as you can. And that's typically pretty intense for the first couple months after surgery.
When can patients expect to return to normal activities?
I generally tell most people to plan to be out of work for about 2 months after hip replacement if they do a sedentary job, and 3 months if they're in manual labor. That way you give yourself plenty of time to get strong and recover from it. And knee replacements typically, I'd say 3 months to return to work.
Many patients are concerned about getting hooked on pain medications following a surgery like hip replacement. How do you help them manage their pain?
We have different ways of treating the pain that don't include opioid medications, but they are part of the treatment. A lot of people after hip replacement surgery don't require a lot of the narcotic pain medications because the severe pain they're having from their hip arthritis is gone, and they have post-surgical pain, which is painful but manageable with even things like Tylenol and ibuprofen and the occasional narcotic pain medication. Knee replacements tend to take a little bit more, and that's in part to help them do those exercises to make sure that their knee can move to the full extent.
What is the pain management process during surgery and for recovery?
So a lot of patients will get either a block or local anesthetic that lasts a couple of days inside their joint at the time of surgery, particularly with knee replacements. And then for hip replacements, a lot of times just the spinal anesthesia itself can give a little bit of time while we give some anti-inflammatory medications through your IV line during surgery as well. So it starts before surgery. We actually give you medications so that way your body is already has a level of those in it while we do surgery, and then you're not as far behind after surgery.
How important is it to keep moving during the recovery period?
Well, we kind of figured out over time that laying in bed and not moving around had a lot of bad consequences for your lungs, for your skin, for your heart, for blood clots. And so kind of over time we've started having people move earlier and earlier after surgery, and we realized that people can do it and they do better the more we have them move. So it's kind of been a gradual process. You know, even in the last 10 years or so, we've really shortened the amount of time that people are spending in bed because we find they do a lot better when they're up moving. The replacements that we have today are really intended for low impact exercises. So walking, hiking, biking, swimming, elliptical machines, golfing. They're not really intended for pounding like running and jogging. But that being said, if you're in the road and a car's coming, you can run to get out of the way. But people do well, and some people do run on them, although it's not recommended. And, you know, I think hip replacements probably feel more natural than knee replacements, but knee replacement works very well for relieving pain from arthritis, and people get back to doing what they want to do after surgery, and that's why we do it.